Hello everyone, I'm Dr. Francisco. I'm alive and live in Facebook once more. This is the bite-sized information for kidney and related conditions. This video blog is destined to help patients or their relatives or their caregivers to understand a little bit more about their kidney disease so they can get into better terms with the disease, because I know it's very difficult to live with these sort of chronic diseases. But if you understand it, you can be on top of the disease rather than the other way around. Also, it can help you to take that information to discussions with your own doctor or your healthcare providers, so you can take more meaningful discussions and better decisions regarding your management. If you take better decisions regarding your management, definitely you can minimize your complications and your worries. And minimizing complications and worries definitely will improve your general well-being, physical and mental, despite having kidney disease. So that's the main aim of this video blog, giving you that information. Today, we're going to continue discussing about diet. The topic of today is a plant-based diet useful in chronic kidney disease. Some doctors favor, and some dietitians as well, plant-based diets, either vegetarian or vegan, for the management of chronic kidney disease, because there have been some benefits observed in some studies, including better phosphate control, less acid load, and even some better protection of the remaining kidney function in some patients. These definitely can help many patients if they choose to be vegetarian or vegan, but not everyone is ready to become a vegan or vegetarian. And also the other aspect or the other side of the coin is that also you will not be doomed if you decide not to become a vegetarian or vegan. You can still have a good balance, moderate, and nutritious diet, being omnivore, meaning eating everything, including meat, and still with a good dietitian advice, try to strike a good balance between their restrictions and nutrition. So at the end of the day, you can choose either or not. So I'm just exposing a little bit of my opinion on plant-based diets. If a patient wants to do it, so I'm very happy for him. If not, we can still advise the patient to have, as I mentioned, a more moderate, balanced, and nutritious diet. Furthermore, it's important to mention that the diet that you choose, the most important aspect is that it is doable, that you actually like it, and therefore you can sustain the diet. No point that you are prescribed a super good diet with, very low phosphate, etc., low protein, and then you cannot eat it, you cannot continue that for a long time. So sustainability is very important in any type of diet, for illness, for health improvement, for weight loss. If the diet is not sustainable, then it's not going to work. The most important thing is that it's sustainable. Otherwise, no point that you have some benefit for 1-2 days, 1-2 weeks, 1-2 months, and then after that, because it has to be for the long run, as everything. The aim is like you can acquire, it can become a good new habit in you, but if it is too drastic, too dramatic, too perfect, it's going to be actually difficult. Improvement is the secret word. So, because everyone has got a different diet and cuisine preferences and cultural backgrounds and different tolerability, so not everyone can, accommodate to the restrictions or to imposing certain diet. So it has to be a negotiation. And basically, a clinical dietitian can help patients to adopt this more moderate, nutritious, varied, balanced diet I'm talking about, is either plant-based or not, and or also how to adopt and adapt yourself to a more mixed diet according to your needs. Indeed, thinking on disease protection with some restrictions, but also thinking about your nutrition, your palatability, and long-term sustainability. And that's one of the aims that we do in Francisco Medical Center. So if you need our help, you can let us know. So if you have any questions, you can leave it now. If not, I see you next week. You can leave your comments and reply. If you like these videos, yes, please give me some likes. Share the existence of this group with others. If you invite your friends, tell your friends to actually fill all the questions, because otherwise it's very difficult to know if it is, like a real or not. There are some people, looking for something not related to the group, or the other days one person started, posting a lot of posts selling something unrelated to the group. So in a way, so that's why I want that everyone, follow all the questions for, mutual respect, and because there are people of different backgrounds. There are doctors, there are nurses, there are patients, there are relatives, there are dietitians, pharmacists in this group. So we just focus in information, key information, and not just to randomly start selling things that are totally unrelated to the group. So for that reason, please fill all the questions. Otherwise, it's very difficult for my team to approve your application. There are people that just put any random words in the questions, like A, B, C, D, or put yes, yes, yes to everything, when the question is asking for a why, the question is asking for an email, the question is asking for something. So in a way, that is not going to be approved, because it doesn't give us the confidence that that person is being serious, wanting to learn something about kidney. If you just put ABCD, 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 or just put yes, 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 or something like that. Yeah. So I'm Dr. Francisco, wishing you the best possible health.